A bit of health now. The National Agency for Food and Drugs Administration and Control has approved the use of Gardasil vaccine as single dose in the routine immunization against cervical cancer beginning from the last quarter of 2023, with the national launch on the 24th of October. At a joint meeting alongside the National Primary Healthcare Development Agency, both agencies agreed that the deployment of HPV vaccine can provide solid protection against cervical cancer caused by the human papillomavirus. Health correspondent Kemi Balogun has more.
Gardasil is a vaccine that protects against the human papillomavirus, a commonly transmitted infection that causes cervical, vaginal, and other cancers. The HPV vaccine, which is given in 2 or 3 doses, is recommended for girls and boys between 11 and 12 years, but can be administered as early as 9 years or as late as 26 years.
To ridicule,
Gardasil has now been granted registration approval for a single-dose use by the National Agency for Food and Drug Administration and Control.
Current evidence suggests that a single dose has comparable efficacy and duration of protection as a 2-dose schedule and may offer program advantages and is more efficient and affordable, contributing to improved coverage.
Many countries, both in the Western and African regions, have already integrated this vaccine into their immunization schedule. However, while vaccination is the most potent prevention measure against the human papillomavirus, we strongly encourage women to undergo regular screening tests for early detection and prompt treatment.
We're talking about 600,000 people getting infected, and 50% of that actually dying. And you realize that about 70,000 of those population actually is happening in Africa. So the introduction of HPV vaccine is actually a big milestone, which we should actually take advantage of as a country.
The introduction of the single-dose HPV vaccine will equally help to address many bottlenecks that currently exist in trying to get vaccines into the arms of those who need it.
The evidence at international and national level shows that rumors and disinformation are based on 3 main issues. One is lack of information, quantity and quality of the information. The second one is concerns about safety. The third one is lack of trust. So I would like to highlight...
The vaccine rollout beginning in October will be done in 2 phases, starting with 16 states, while the second phase for the remaining states has been scheduled for the first quarter of 2024. Kemi Balogun, TVC News, Abuja.